Good morning, everyone. This is Lawton Davis in Savannah, and I would like to take this opportunity to call the 91st annual meeting of the Georgia Public Health Association to order. And thank you all for taking time to log in and to participate. As you know, we were unable to have a meeting in the spring of 2020. And we also were unable to have a meeting in the spring of 2021. And I'm pleased that we were able to do this virtually at this point in time. What I would like for us to do, the current GPH Executive Committee members are myself as president, Dr. Chris Rustin is president-elect, Dr. Colin Smith is the immediate past president, Dr. Soroy Morris is the vice president. Cindy Hart is our secretary. Morris Hutchison is the treasurer. And Yvette Daniels is our parliamentarian. Dr. Judith Monroe is our keynote speaker today, and she will be formally introduced at the conclusion of the opening business session. I would really like to recognize the Jiann-Ping College of Public Health at Georgia Southern, and especially Angie Pedens for sponsoring the conference's virtual meeting platform and coordinating it. Also, Magnolia Coastlands Area Health Education Center, also known as Magnolia Coastlands AHEC, is recognized as a program sponsor. As well, Georgia State University and Fort Valley State University are also being acknowledged as supporters of the conference program. The first order of business of the 91st annual meeting will now begin with the credentials report presented by Secretary Cindy Hart. Cindy.
Mr. President, the total number of persons registered for the 91st annual meeting and conference held virtually of the Georgia Public Health Association is 322. I move for the adoption of the credentials report.
Thank you, Cindy. There is a motion on the floor for the adoption of the credentials report. This report comes from the Credentials Committee consisting of Cindy Hart, Katrina Bowles, and Sally Silberman, and does not require a second. If anyone is opposed to the adoption of the report, please indicate by typing no in the chat box. The report is adopted. The next order of business is the adoption of the conference program. And I would really like to express my sincere appreciation to the executive board and the conference planning chair, Dr. Soroy Morris, and her conference planning team for their efforts this summer. Not only has she had to put up with me on a day-to-day basis, but she's been working hard on this as well. Dr. Morris, would you please present the conference program?
Mr. President, the conference program is printed in the 91st annual meeting and conference syllabus, which has been distributed to all of the conference registrants. The program includes 1 keynote speaker and 4 breakout sessions. Continuing education will be offered for several of the breakout sessions. There is a ceremony to recognize our 2020 GPHA award recipients. Please note on page 41 that the correct credentials for Julianne Gaston, Nutrition Outstanding Leadership Award recipient, are MPH RDN LD. All materials have been provided for the annual Business Association meeting. The silent auction will close next week on August 27th at 5 p.m. Everyone is encouraged to bid on a variety of items. Details concerning the silent auction are available on page 52 of the syllabus. Mr. President, I move that the conference program be adopted.
Thank you very much, Soroya. There is a motion for the approval of the 91st annual meeting and conference program. Anyone opposed to the adoption of the program, please indicate in the chat box. The program is adopted. There being no further business, this business meeting is in recess until the closing session. The theme of the 91st GPHA Annual Meeting and Conference is Celebrate the Power of Public Health. We're really pleased to have so many of you enrolled. We know that you have been very much engaged in a variety of activities as we've all rallied to address the nuances of this pandemic. We have a busy day planned for you, and we hope that you will enjoy the breakout sessions as well. And Soroya mentioned the silent auction, and I would certainly encourage you to visit that and to do some bidding and support your GPHA, the association. At this time, Vice President Dr. Chris Rustin will introduce our keynote speaker.
So good morning, everyone, and it's good to see a lot of faces on this on the screen this morning. We certainly haven't had an opportunity to get together in a long time, so I want to thank you all for attending the conference virtually and supporting the Georgia Public Health Association. I'm very pleased to introduce our keynote speaker, Dr. Judy Monroe. I'm going to read her bio. And Angie, I believe you have access to her presentation that you will upload shortly. Dr. Judy Monroe is the president and CEO of the CDC Foundation. In her work at the CDC Foundation, Dr. Monroe advances priority programs that improve the health of people across America and around the world. She joined the CDC Foundation following her role as a deputy director of the U.S. Centers for Disease Control and Prevention and director of the CDC's Office of State, Tribal, and Local and Territorial Support. During her tenure as the State Health Commissioner for Indiana, Dr. Monroe served as a president of the Association of State and Territorial Health Officials through the H1N1 pandemic. Dr. Monroe was instrumental in mobilizing funding to build a blueprint for the Atlanta-based Global Health Crisis Coordination Center and its initial launch. She currently serves on the board of directors for the Center for Global Health Innovation, was appointed this month by Governor Holcomb to co-chair a public health commission for Indiana, is a member of the Millikan Institute Public Health Advisory Board, the COVID Collaborative, the Advisory Council of the Pandemic Action Network, and the APHA Alliance for Disease Prevention and Response. Additionally, she served as a member of the World Health Organization's Foundation's Advisory Group to establish the WHO Foundation. Among her many awards, Dr. Monroe was recognized in August of 2021 as one of Atlanta's most admired CEOs for 2021 by the Atlanta Business Chronicle. In October of 2020, she was awarded the United Way of Greater Atlanta with the Woman of Excellence Award for her unwavering commitment to serving the community. In 2019, she received the Metro Atlanta Chamber of Commerce MAC Heroes of Global Health Award and the APHA Presidential Citation. And so with that, I'd like to welcome Dr. Monroe as our keynote speaker.
Thank you so much. First of all, just let me tell you, it's such an honor to join you today. You all are real heroes. I just want to thank all of you for the enormous work and the hard work that you've put in, especially over this last 18 months. It's been a tough time. I think my slides will be going up here in a moment. But as we think about the theme of the 91st convening of the Georgia Public Health Association and the power of public health, I was just on a call yesterday with a few of my board members, and one of the board members said, they said, you know, public health has been wanting to be visible for a long time and have more visibility. And you got it, right? The last 18 months, public health has been in the news every single day. And someone on the call said, yes, but we wanted to be out there, you know, for things that are really, really positive and not under so much fire. And the board member said, you know, you just can't have it both ways. And it's a sobering reality, but public health is powerful. And you all, the work that you do touches every life every day. I mean, folks just have no idea how much public health impacts all of us. So I do want to thank all of you very, very much. If we go to the next slide, before I get into the work of the foundation and some of what we've done, again, just a sobering slide, and I think in the moment of time that we're in, I'd be remiss if I didn't at least make a few comments on the current state of the pandemic. This slide is from the CDC tracker. You know, they have, if you go to CDC site, they have lots of data. And of course, we had to put my slides together a few days ago. So you can see here that with the exception of 2 states, every state had the highest level of community transmission of COVID-19. Since this slide was put in my slide deck, Vermont has gone red. And so now we're down to just 1 state that is the next level down in the orange category, and that's the state of Maine. And so and we're seeing in the headlines, of course, you know, Governor Kemp just announced the National Guard being deployed to our medical centers to help. In Georgia, nearly 2,000 children are testing positive each day. And this Delta variant has once again shown us how this particular coronavirus, this novel coronavirus, has continued to surprise the scientists and be more of a challenge for all of us. But it's a whole of society threat, as you all know very well. News every day is coming out. It was great to see the FDA this week approve the Pfizer vaccine. Moderna has now completed their submission to the FDA. So we now have a fully FDA approved vaccine for 16 and older. Moderna will be 18 and older. We've got now the 3rd dose approval by the FDA for those that are immunocompromised. And I think we're right on the heels of hearing soon about booster shots for the general public as well. But it's record-breaking times for public health. We just broke this week across the United States, more than 100,000 people are hospitalized now with COVID. We've not seen that since January of 2021. And we just continue to break records. The next slide shows how we are breaking records for new hospital admissions of patients with confirmed COVID-19, ages 0 to 17. Again, this is taken from CDC's data. And again, this is a few days behind the times, and that number, that line that's almost going straight up on the graph there is rising as well. We've nearly tripled hospitalizations just in the last month across the United States. And so with all of that, it's just so important that we continue to support one another and come together. So with that, let me go to the next slide and introduce to you all. Some of you are familiar with the CDC Foundation, others maybe not so much. I want to give you a little background of what we do, and then and specifically what we've done during the COVID-19 response, and how we work in partnership with many sectors. So first of all, the CDC Foundation, we are not the CDC. We are a completely independent organization. However, we have congressional authority to work with CDC. The congressional language was written in 1992, and that legislation was passed, and we became an independent operating 501c3 nonprofit organized here in Georgia and in Atlanta. And we went to work in 1995. And so what we do is we have the advantage of being a nonprofit that can move with speed and agility faster than government can move. And that we try to leverage that working with our partners in government to be support and to advance the life-saving work of CDC as well as public health across our country. And we're in many countries as well. We have, at any given time, we have upwards to 300 active programs. About half are typically in the United States, half around the world. We've been in at any given time about 140 countries because of the global work that CDC and our partners do. So if we go to the next slide, I want to talk through with you a little bit our partners and what this looks like. And one of the things that we think about with our work at the foundation, we're a catalyst, and we get our work done through public-private partnerships primarily. We're kind of at the nexus of the world of philanthropy, the world of government, and business, and then on top of that, nonprofit organizations. So we have individual donors. We are not an endowed foundation, so we have to work to bring in the resources. And we've enjoyed, particularly during COVID, more individuals that have recognized the work of the CDC Foundation and the importance of public health, and came and answered our call for support. We have a number of foundations and philanthropies that we work with over the years. The very large ones are the Bloomberg Philanthropies, the Gates Foundation. They have been longstanding partners, particularly for global work. Here in the United States, we have a strong relationship with the Robert Wood Johnson Foundation as one example, and many, many others. And then for corporations and businesses, we do a lot of work there. We have a corporate roundtable that we convene, and we will bring business leaders together and organize meetings with CDC leaders so that they can be kept abreast of what's happening and how CDC is approaching particularly global threats. Nonprofit organizations, a whole host of partners there. And then educational institutions. So we have a number of partners with universities, many of them here, and I'll talk a little bit more about that in a minute, here in Georgia. And then for the US and international government agencies, we have a two-way street with CDC. And so we are, as an independent nonprofit, we have the opportunity to compete and apply for cooperative agreements, which we do receive from time to time, either through CDC or through other like FEMA and HRSA and some other government agencies, federal government agencies that we have worked with. And then I'm happy to report that we actually have a memorandum of understanding and a partnership with the Fulton County Health Department and with the Georgia Department of Public Health. Thanks to Dr. Toomey, we've negotiated agreements so that we can serve as a nonprofit arm when needed, because we've got the infrastructure that has been built over the years to be able to activate. If we go to the next slide, this gives a little bit of the breadth. So since 1995, when we became an operating foundation, and when I became the CEO, I became a student of the foundation. So if you look at the growth of the foundation, not uncommon that new nonprofits may start slow. So the first 10 years or so, there was kind of slow growth. And then with Bloomberg and Gates coming on board, there was an increase. We've provided over $1.6 billion to help support CDC's work and work in the field. About $1 billion of that has been just in the last 5 years, and a significant portion just since COVID. We've built a really powerful network. So we've got it's countless numbers of businesses, as I mentioned, and universities and other partners in our network. We have launched more than 1,200 unique programs since inception, and we have the data from many of these programs to show that millions of lives have been impacted or saved throughout this work. So it's a pleasure to be. We're like the assist on a basketball game, I guess. You know, we assist. We may not put the points on the board. It'll be the Public Health Agency or CDC, but we're there assisting along the way and trying to support. Next slide. So our work is very broad. I mean, we do work, because CDC is such a broad agency. We've got programs in injury prevention and maternal child health and non-infectious disease, infectious disease, environmental health. But I want to focus today on what we've done during the emergency response with COVID, which, again, record-breaking. We broke records for fundraising. We broke records for the type of work we've done, and I'll tease that apart here for you a bit, and then try to focus also on what we've done specifically here in Georgia. But since January 2020, so a little bit of how we work. As you all will remember, the pandemic was, we were hearing about this novel virus coming out of Wuhan, China, various reports. The US, we weren't all that worried initially, But then CDC activated their Emergency Operations Center in mid-January. And about 4 days later, I reached out. At that time, it was Dr. Ann Schuckett that I spoke with, and Sherry Berger, who was the chief operating officer at the time, and had a phone call on a Sunday afternoon with them and said, you know, this thing looks like it could get pretty big, and do you want us to lean in and activate our emergency operations at the foundation? And they agreed that yes, we should. And what that means for the foundation, I get approval from our board to go into emergency activation. And it really means on the front end that we go out publicly, that we're fundraising, that this is something that we need support for to be able to help support public health. And then the next day we put out a press release saying that we were activated. And with that press release, we were able to announce that the first $1 million donation had come from the Robert Wood Johnson Foundation. So that's that power of partnerships and having long-standing partnerships. We were able to get a commitment on a Sunday afternoon to come out in the press release. To date, we've raised over $514 million since that first 1 million came in the door. And that has been applied to nearly 300 distinct projects across the United States and globally. We made a commitment, and I personally felt this was very important, an emergency response. And when our donors are donating, we want to be good stewards of that. If you're donating to an emergency, I think as a donor, you expect that to be used quickly and efficiently. And so we set a goal that at any given time, at least 90% of all donations would be obligated or spent at any given time. So we were actively hearing what the needs were and mobilizing our resources to try to make a difference. I think at this point we've expended or obligated 98.9% or something like that. So we're running a tight ship. With that, a few things on this slide to talk about. I'm going to dive deeper in what we've done with community-based organizations in a minute. But something that was unique for the CDC Foundation, we have always had CDC Foundation surge staff for programs, but it was a smaller number. We were, because of the need for surge staffing and because we could hire more quickly, we ended up hiring over 1,000 surge staff on the front end of the pandemic. And we are now in the process of hiring another 2,000 to 2,500. Literally every state health department in the country had a CDC Foundation core group of foundation field staff. Many of the states asked us to deploy some of those field staff to local health departments. And we supported the 6 largest cities, tribal organizations, and territories. And it was a variety of types of positions, all the way from epidemiologists to data analysts to communications, everything you can imagine that was needed. We also, and this is an interesting story, we've gotten into creative financing. For government, for procurement laws, they can't pay for something they haven't received yet. So particularly in the state of California, they needed personal protective equipment. And when we were early in the response, if you remember, folks were trying to get quality PPE from China. But as an example, the state of California couldn't pay for the PPE. They had the money for it, but couldn't pay for it until it was shipped. So we ended up developing a revolving account where we had some large nonprofits that gave us funding at the foundation that we used to purchase PPE and procure that from China, to pay for it up front, get it deployed to, as an example, state of California. And then when they received it, California paid us for the PPE. We in turn took that money and bought more PPE and just created this revolving account. And then at the end, we gave the money back to those nonprofits that had given us the funds to be able to do that, with the exception of just some administrative fees to cover our costs. So that was one of the creative things we did. We've supported, of those 300 programs, over 125 have been health equity related. We've launched a number of national communications campaigns throughout the pandemic. And one project that I'd like to call out is the Health Action Alliance. This is something that we pulled together and we financed it along with, we needed other partners to come in. So we brought in the Ad Council, the Business Roundtable, de Beaumont Foundation, the Robert Wood Johnson Foundation, and then of course CDC Foundation. And this is being powered or managed through a social impact group called Mediarite. They are excellent individuals. And what they've done, there were 3 areas of focus. What we wanted to do was offer to businesses of all sizes resources that were near real time, that were developed for them to be really user friendly, and to share best practices among businesses. There were 3 areas of focus. One was vaccines, what businesses could, what role they could play for vaccines, equity, and then the third was rebuilding the public health system, support for public health system. So if you go to their website, you'll see, I mean, there are a number of things that they have been able to offer. As an example, the latest thing that we just did with them was a big webinar and resources around not just COVID vaccines, but childhood vaccinations, trying to get kids caught up with their vaccines and what businesses could do in terms of their policies for letting parents off work, giving them time to get the kids vaccinated, as an example, along with the COVID as well. So anyway, there's all kinds of toolkits, communications that are available that are user-friendly for the businesses. So let's go to the next slide. So a little bit about our community-based organization support. This again was somewhat new for the foundation. I mean, we've really flexed our nonprofit muscle, I guess, if you will, and our flexibility. And it became very clear early on, as you all know, that to really get the uptake of vaccines, a lot of discussion around equity and trusted voices. And we felt like community-based organizations close to the ground, close to their communities. And so we've had the opportunity, both through federal cooperative agreement, as well as a number of private funders have given us the resources to be able to do grants to CBOs, somewhere in the range, most of them are $25,000, $50,000, some of them $75,000. There was one case in earlier in the response, to give you a story about some of the way we work. CDC called us, and in Richmond, Virginia, there was a situation where in Richmond, where there were a Latino population, and they were gig economy. A lot of them, worked in service industry, or they drove Uber or Lyfts and those kinds of things. And this community in Richmond, Virginia, had the huge outbreak of COVID. And this was prior to any vaccine being available. But the problem was they were also, due to this, they were on the verge of homelessness. So they had an entire community that were about to lose their homes. So CDC was called in. They sent in Spanish-speaking epidemiologists to help in the community. And I got a call one evening saying, can the foundation help at all? Because this is a really urgent situation. And so I got on the phone. We talked like with the mayor's office, the state health department. So it was local and state and business leaders. And we said, we'll help. This sounds like something that is really important. In that case, we were able to provide $500,000 to that community, but we gave them the caveat that only if you match the funds. You're going to have to bring in matching funds because this is big. And so they did, and they tripled or quadrupled the amount of funding pretty quickly that we brought in. The good news of this story is that it averted the homelessness. I mean, they were able to really bring in all the resources needed to make a difference and keep folks in their homes. So we were very, very proud of that particular work. Here in Georgia, you can see this is the list on this slide of the community-based organizations that we've been able to support to date. We're trying to rally more resources, and actually I just got notice this week of another $1 million that's coming in from a donor that will be able to help more community-based organizations. The other thing that we've tried to do through this is to try to connect the CBOs to their local health departments and assure that there's alignment with this. Many times before we would fund a community-based organization, we would ask for a letter of support from the local health official so that we were aware of, yes, this made sense in this community through the expertise of the local health officers. So we've done a lot of that, trying to make sure that our partnerships that we may mobilize are aligned with governmental public health and the leadership. We can go to the next slide. So this slide shows you the latest slide we've been able to put together. We're up to 175 community-based organizations that we've funded. Again, this number continues to grow. And of course, now with the Delta variant and the surge, I think it's not just the CBOs need help, not just with vaccines and the trusted voices, but also the other social needs that are arising because of all of the infections that are taking place. But this gives you an idea of the breadth of our work. We're very conscious of the states that we've not funded any CBOs, so we're trying to pay attention to that and where it makes sense that we might be able to fund, but also we're particularly focused on the hot spots in the US as well. Next slide. This slide will give you an idea of just the cooperative agreement that we received earlier in the response back in 2020. With that cooperative agreement, we hired 740, what we called our COVID-19 core staff, and they were placed in 79 jurisdictions. So you can see on this slide, Georgia got 16 CDC Foundation field staff. And now, as I mentioned, we've got another cooperative agreement where we're going to be hiring 2,000 to 2,500. So that number's going up for all of the states. We can hire many more, and we're have reached the state health departments to see what the needs are, both in the state health departments and then what might be needed in the state, across their states locally as well. In addition to the 740, we hired over 1,000. And again, that was about 350 positions we were able to hire on private resources. So we had donors that came in and thought it was important to help provide search staff to health departments, and they privately funded some positions as well. So that was really good news. Next slide. So one of the areas, and I know you all are centered on this as well, obviously the health inequities brought on by COVID have been important to all of us. And we created in October, for the first time, the CDC Foundation created a Chief Health Equity and Strategy Officer. Her name is Dr. Lauren Smith. She was a health officer in Massachusetts, and most recently with FSG, which is a social impact consulting group. So Lauren came in, she hit the ground running. I would have to tell you, one of her first tasks was to work with the Satcher Health Leadership Institute at Morehouse. We had already teed up this work. I had a phone call last summer from Daniel Dawes asking if we might partner with them because they had a vision for a health equity task force, but specifically they were really looking at data and looking at creating a health equity tracker, so we did come in. This was another one. We came in with some early funding. I should note, one of the things that we've learned along the way, and I think because CDC is in our name, when we're able to provide early funding or catalytic funding, other donors will follow. So we did fund the Satcher Health Leadership Institute last summer. This has been a partnership now with Google, and other donors have come in and they launched. It's really received high acclaim for the tracker that's been put in place and will continue to be improved upon and so forth. We also did, we had a fair amount of work that we've done with other historically Black colleges and universities, particularly in the South, and that's been focused on equity. So that's been part of our equity work, which is a pretty broad portfolio for us right now. Let's go to the next slide. So I want to just give you an idea of something that's non-COVID related that we've done here in Georgia. And this is a blood pressure project. This was pre-COVID that we started this. And one of the things we've been talking a lot about is, we are a nonprofit here in Georgia. We do work around the world, but this is our community. This is where we live. And so we've had a lot of conversation about Georgia being, sites that we should be utilizing for testing models, testing ideas. And so in this case, CDC, we worked with CDC on a pilot for hypertension medication therapy management in work sites. We called it Blood Pressure First. And in this case, we worked in Dalton, Georgia with engineered floors. We collaborated with the American Pharmacists Association Foundation. And then we offered the employees, or through the engineered floors healthcare beneficiaries, the opportunity to engage in pharmacist delivered blood pressure management program as a pilot to looking at how this might go to scale. And participants did lower their blood pressure by an average of about 11 percentage points and body mass index by an average of about 0.7 percentage points. So that's a non-COVID example of the type of things that we do. A few other things that we've done during COVID that I want to mention, and then I would love to get into dialogue and answer questions. I'd love for this to be interactive. So I'm giving you a smattering of the kinds of things that we do. But I wanted to mention mental health. I mean, mental health, the reports coming out from CDC and others, it's our healthcare workers, or it's our public health workers, and the community at large. Or we're seeing obviously the opioid crisis and substance use has skyrocketed with COVID. So mental health is just critical to all of us. We helped spearhead a project that CDC wanted to do called How Right Now. And we hosted it on our website to begin with and kind of launched it. This is typical of what we do. We kind of, we get things started, and then CDC, federal funding became available after the philanthropic support. Federal funding became available, and this is now a program, and it's hosted by CDC. It's a communications campaign for mental health. And if you just Google How Right Now or go to CDC's website, you'll see that it will ask you questions. How are you feeling right now? Are you feeling angry? Are you feeling frustrated? Are you feeling hopeless? And then depending on what you answer, it will take you to various resources to help you in the moment that you might read and see. But also it's got search capabilities for you to be able to find in your local communities support as well. So that's on the mental health side that we've done. On the communication side, last summer, as an example, I mean, you all have lived this. Public health officials across our country, I don't know how many we have lost now that have either resigned or have been fired or just couldn't take it any longer. And the communications, getting the public health message out has been challenging for a variety of reasons. So we put our heads together with some other public health nonprofits, and we launched the Public Health Communications Collaborative. The de Beaumont Foundation and Trust for America's Health and the CDC Foundation and other partners came together around that. And that group has been offering to folks in public health regular communications, giving them tips on how to communicate, giving them tools for how to maybe break through with the communications and keeping them up to date. So that's been work that we've been very happy with. The APHA, I'm having every couple of weeks, I talk to Georges Benjamin at APHA. We were the first funder for the APHA Alliance. That's kind of a big tent for things related to COVID. We will be hosting a session or discussion forum at the APHA meeting in October, but that's been great. And that was another example of where we were the early funder and then other funders came to bear. Georgia said he just kept taking to the bank that the CDC Foundation had been a funder for the APHA Alliance. So that's been really rewarding for us to have enough flexible funding to be able to fund some of these opportunities. We've also funded early in the response. I just wanted to mention some of the research we funded. We funded the University of California at San Francisco leaned in really early to do work on pregnant women and infants, because obviously it's a novel virus that we didn't know what the results would be. Obviously, now, of course, it's very sad news coming out of Alabama and other states where pregnant women are on ventilators at highest rates that they've ever seen. We also funded a multi-state collaborative research project on clinical care that CDC requested that we do. So our range has been from data systems to research to, as I said, on the ground, local. We've funded here in Georgia. I think it was in the chat. We early on funded a couple of the local health departments that came to us with some requests. So anyway, we try to lean in, and I think there are questions starting to come in the chat. If that's the case, maybe we can. I think the last slide is just the closing slide, and we can. Well, the last slide was just this was in my introduction, but we have been very involved with the Global Health Coordination Center that has been launched now here in Atlanta, and launched actually right at the start of the pandemic. And then the Center for Global Health Innovation is now the umbrella organization that brought in Georgia Bio, and the Georgia Global Health Alliance was an early organization that's now come under the umbrella of the Center for Global Health Innovation. So just a nod to the forward thinking work and highlighting Atlanta as a center for global health, and Georgia at large. There's so many great partners here. So with that, do we want to move to some dialogue or Q&A?
Yes, absolutely. Thank you again, Dr. Monroe. And so the way we're going to do the question and answer is I've asked people to type questions in the chat box. And so I will read those to you. Some of those I'm just screening now that have kind of a common theme. So the first question that, well, let me start actually with a comment. The Cobb Douglas Public Health Department, Public Health District posted that they are so appreciative of the CDC Foundation's support at the beginning of this pandemic, and they thank you for helping them launch a very quick response and helping them fill critical gaps. And so that's from the Cobb Douglas Public Health District. The first question, and I'm kind of combining 2 or 3 questions here, is how, outside of COVID, how can the CDC Foundation support CBOs or health departments, specifically around nutrition or breastfeeding or other non-COVID related public health activities? Is there a mechanism for that type of support that you can talk to?
Yeah, thanks for the question. I think what's happened, many people have called COVID an accelerator. And so for the CDC Foundation, this has clearly been an accelerator for some of the things that we were beginning to envision that we might be able to do. I personally, when I came to the foundation 5.5 years ago, having been at CDC, having been a state health officer and a practicing physician prior to that, it was like, wow, this is kind of a gem. The CDC Foundation, it's a very unique, we're very unique in the ecosystem. We're a very unique nonprofit. And so my burning question was, what is the optimal role that the CDC Foundation can and should play in the ecosystem? And then COVID came, and prior to this, if you look historically, the foundation did not have really flexible funding. Our funding came in and it was all restricted to particular programmatic work that the donor wanted to have, was willing to support. And we also had not done very much with cooperative agreements through CDC and others. So we've filleted open this new opportunity on the horizon. And I think our donors that are supporting our community-based organization work now, we will be able to go back to as things settle down with the pandemic and start addressing things like nutrition and the issues that are embedded in this question. So I'm very much looking forward to what we can continue to do that really have turned out to be best practices in COVID, but they came to us in an emergency. So translating that into now the future. The other thing I'll just mention, I think the way we need to also be thinking about this, and you mentioned in my intro, just last week I was with the governor of Indiana, where he announced that they'd asked me as a former Indiana state health official to come back and co-chair the governor's public health commission on public health. And they're looking in Indiana, what does the future of public health need to look like? What about the funding? Obviously, I mean, most people will tell you public health needs more funding. But what is that structure? What's that design look like? North Carolina has some pretty intense work underway. And I think we're going to see more and more states beginning to ask that question. Certainly it's being asked nationally as well. And there's a lot more funding coming into public health, at least in the moment. So I love that question, because I think those are the kinds of things I would love to hear from folks, what they would see as roles the foundation might be able to play to help move the field along.
All right, thank you. The next question is from Michael Powell. How can a local organization connect with organizations to utilize the media tools referred to with messaging related to mental health?
Yeah, so for the mental health, that's and I can maybe after this I'll get with Craig Thomas, is the division director at CDC, who's overseeing the How Right Now and the mental health. And I know they've got something like 35 partners already, and we've been talking about trying to expand that partnership. I think this question really calls out how many times some great tools are developed, but they don't always get to everybody who could use them. And we need to do a better job of disseminating and making sure people are aware. So I will talk to Craig Thomas about that and get some communications out to you all afterwards. But definitely they're there for that. They're open source. The same thing with the Health Action Alliance, all the resources on their website, that's all open source. People can use those resources at however you wish. And the other thing I would comment on, communications is an area that we've been talking a lot about at the foundation in terms of how does public health communicate differently and use today's communication tools. We can talk, that could be a whole session.
Thank you. So our next question is from Dr. Debbie Hagans. Are there any resources such as recorded presentations about the different types of COVID vaccines, for example, the messenger RNA versus vector, that can be shared with our patients, the community, and particularly healthcare workers to address their fears and uncertainties of being vaccinated? And then the second part to that is, could you comment maybe quickly on how this vaccine was developed compared to traditional vaccines? I think there's still questions about the fact that it was done, in some people's minds quickly or too quickly.
Yeah, no, that's a really terrific question. And so first of all, the first part of the question, there are some videos, and I can share some of those I had shared. I'll share with you all after the conference, and you can disseminate. Some folks have put together some pretty good communications around the different types of vaccines and how they work with nice graphics. I've had the privilege, because we do so much with public-private partnerships, I've had the privilege of being invited to speak to, like, as an example, like Dell asked me to do a session for all of their employees worldwide, specifically on vaccines. And I talked a lot about the messenger RNA methodology. One thing that's really important for folks to understand is the messenger RNA technology has actually been researched now 30 years. I mean, there's a wonderful, kind of sad story in some ways, but one of the primary researchers actually took demotions in her academic career because she believed so much in the messenger RNA technology, but nobody was funding it. Folks weren't, 30 years ago, 25 years ago, they weren't funding it. So she actually took a demotion because she believed in this. She's now, one of the heroines of this story. So this has been researched for many, for decades actually. And what I love about the messenger RNA, it's unlocking that potential because the messenger RNA is what leads to our body's ability to make new proteins and respond. And the vaccine itself, the messenger RNA, actually is destroyed. You don't even, all it does is give the code to your own immune system to be able to develop the antibodies. And so your immunity is actually natural immunity once you've had the vaccine, and the messenger RNA itself actually is destroyed by your macrophages and other body defenses. And it's brilliant technology. I personally am just mesmerized by it. It also is technology. Pay attention to it, because I think for managing different cancers and other diseases, we're going to see messenger RNA technology take off. I really believe so.
Thank you. The next question is from our president, Dr. Davis. Childhood oral health, especially in rural areas and specifically in Georgia, is a huge need. Does the foundation have any interest or activities in this area?
Yeah, thanks for the question. So that's another kind of pre-pandemic interest that we had. I actually had been, I got together with Delta Dental just prior to the pandemic, or maybe right at the start of the pandemic, and have had some conversations with some of the nonprofits actually in North Carolina that had a real interest in oral health in rural communities. We've also connected with some of the there's a whole network of rural philanthropists, and that's actually a topic. Oral health is an area that we were working on that went on the back burner, as you can imagine, through COVID, but that's another one that I think we need to refresh and take a hard look at. And CDC does have, an oral health. They've got a small group at CDC looking at oral health as well.
All right, thank you. Let's see, I'm looking to see, I don't see any additional questions, but let's give it a few minutes to see if we have a few more questions typed in.
Yeah, and while we're waiting on that, I can maybe talk a little bit about, when we look at the public health system of the future, I think some of the things to be aware of is that CDC has received funding and is really leaning in on data modernization. So they have a data modernization initiative. Health equity is front and center for looking at the public health system of the future. A number of reports were done prior to this moment in time, and the Bipartisan Policy Center is working now. They have a whole group that's working on kind of scoping out what the components of the public health system and public health departments should look like moving forward. Stay tuned. There's a lot happening.
So we have another question that came in from Dr. Lawton Davis. Is there any chatter about a multivalent messenger RNA vaccine for COVID-19 or combining flu vax with COVID-19? There is some discussion underway. I'm not well versed in the details of that research, but I have read a couple of articles where folks are discussing those kinds of topics. Okay. This question is from Dr. Janet Memark. She's the district health director for the Cobb Douglas Public Health District. Her question is, Dr. Monroe, what is the CDC involved with globally at this time to help COVID on a much larger scale, a bigger level?
Yeah, thanks for the question for that. And so what we're primarily involved in, CDC, has a presence worldwide, and they're in a number of countries. And what CDC has specifically asked us to work on is something that they actually call SOS. So it's the international SOS for COVID, and it's to support sequencing in countries. And obviously, we've got to keep ahead of these variants. So the sequencing capabilities and the lab capabilities in various countries. Oxygen is needed in many countries. And then shots in arms. And so we have been involved. I'm part of the Pandemic Action Network and some other groups globally that are working on trying to ensure that more vaccine is getting to the countries of need, and then that vaccine's being equitably distributed. So those are the SOS is our three big things. Thanks for the question, Janet.
So the next question is from our Bibb County Health Director, Dr. Haynes. Academic public health programs have seen unprecedented growth during this pandemic. How can we at the local district or state level capitalize and sustain this emerging workforce for the days ahead?
Wonderful question. So a couple of things that reminds me of something I wanted to mention. So on the early part of the pandemic, when we were hiring all those surge staff, many of those were contact tracers, and many of them were like right out of college, right? And they were on the job training. I cannot tell you how many of those individuals are now pursuing public health careers and degrees. They really got mesmerized by public health coming in and working on the front end. So there's that. So I'm not surprised that there's a push. I mentioned that we're hiring 2,000 to 2,500 additional search staff, but in addition to that, the states have received workforce funding. And so I'll give you an example of New Jersey. New Jersey is looking at creating in their own state something similar to the Public Health Associate Program, PHAP, which CDC, and I ran that program when I was at CDC. PHAP is a program where folks either out of college or with their MPH get practical experience in health departments. They're placed in health departments for that on the ground training. And so New Jersey is looking at using some of their workforce funding. They would like to have a public health associate type in every local health department. They'd like every local health department to have an assigned trainee. We also are finding some of the states want to use some of our surge staffing to hire early entry, folks right out of school to be able to work in their health departments. And we're trying to work on a system to make sure there are mentors. One opportunity through our surge staffing is early retirees, folks that maybe have retired from the state or local health that are in their retirement. They can't go back to work maybe for the state, but they can be a CDC Foundation field staff and maybe be a mentor for those kinds of programs. So I think would love a deeper discussion about that as we're learning what other states are doing as well. I think there's huge opportunity. And we need to do it if we're going to be serious about our future workforce.
And this is the last question because we have to wrap this session up. and apologies up front for most likely butchering this name, but this is from Otuata. The question is, are there any efforts supporting or addressing maternal infant deaths?
Yeah, so CDC is primarily involved in that. We supported the research on the front end, but CDC is involved with that, and then some of our community-based organizations are supporting So it's support for families, but then we had been very involved early on maternal death. We've supported before COVID the maternal mortality reviews at the state levels. But that would be a question probably for CDC, because I know their group over there, the division over there is keenly interested and distressed over the maternal and infant deaths.
Thank you. So Dr. Monroe, thank you again for this engaging presentation. And on behalf of the Georgia Public Health Association, we really thank you for serving as our keynote speaker. We would love to continue this engagement and discussion with you in the future. So thank you again.